Good morning. Megan here from Wisteria Dental Care, and I have a little helper here with me for our Tooth Talk Tuesday today. This is my older son, Vincent. He is 6. He's off school today for election day, so I have him here in the office to get his teeth cleaned. So I thought I'd take this opportunity to actually show how we brush teeth at home. So I have a lot of parents who come in here who ask, what is the best way to brush my kids' teeth? I have a hard time, it's hard for me to see in the back, it's hard for me to reach places, and they're constantly struggling with a lot of plaque on their teeth because it is kind of difficult. So I just want to show you what has worked for me, because then maybe that can switch some things up for you at home. Now, for your younger kids, this probably isn't going to work. I started doing this with my kids around the age of 3, maybe 2, 2.5, depending on how cooperative they are. For the younger kids, really what I was doing when my children were babies or even young toddlers was I was laying them on the floor, sitting down and kind of putting my legs on either side of the child. If they were being uncooperative, I would tuck their arms underneath my legs. And then that way I was able to get a good visual by looking down into their mouths, and they were not flailing around all over the place. Sometimes they would cry, but you get it done, and you get it done fast. And that is just how it is. We have to get our kids' teeth cleaned, even if they're crying when they're young like that. As they get older, they're more used to having it done, so it's not really a traumatic situation. But do what's best for your family. Take your child's emotions into account, whatever works best for you guys. But that's how we used to do it. So let me kind of show you what we do for our older kids. Typically what I do is I have them stand in front of me, just off to the side, so kind of like this, at the bathroom sink. When I always start with flossing, floss first, floss, and then brush. What I do is I take our floss. All right, go ahead and tip your head back for me, babe. And then as he opens, then I am able to look directly down into his mouth, and I can floss really easily. Okay, I can see these bottom teeth, I can get this done, and when I go to the top teeth, what I'm doing is I'm taking this finger that's holding the floss and I'm kind of pulling back his cheek. And again, I can see in the mirror in the bathroom, like right now I'm just looking in the camera to do this. I don't even really have to look down. Now that does take some practice. I look in mirrors all day long to clean my patient's teeth, so this is probably a little easier for me. But the more frequently you do it, the easier it's gonna be for you as well. And same thing for brushing. Go ahead and tip your head back again. So all I'm doing is having them stand straight up in front of me, just off to the side, tipping the head back, and then you're able to access all these really hard areas to get in the back. And using the edge of the toothbrush here to actually retract the cheek back, so then that way you're able to get down next to the gum line. And same thing down here in the front. A lot of kids tend to tighten up their lip when you come around to the front here. So I've always kind of taken the toothbrush and kind of pulling down the lip as I'm brushing here. You can also go, really you should be going side to side like this. But if the child's lip is getting really super tight and you're supporting their head like this, you're not actually able to retract their lip with your hand. So kind of getting in there however you can to make sure you're thoroughly brushing at the gum line, okay? The other really, really tricky place to get is the bottom teeth down next to the tongue, especially if your child is a gagger. So what I found, and Vincent has had some issues with gagging in the past, what I found really, really helps for this is having the child say ah while you're brushing. So the whole time have them go ah, because what happens is it relaxes the muscles on the floor of the mouth. They're not going to be fighting you with their tongue. And if a child is humming or making that ah sound, it actually distracts them, and kind of it's a little bit of muscle confusion. It's using some of the same muscles that work with the gag reflex. So if we can do that, then that allows for you to get back around those teeth a little better. So go ahead, Vinny, show them how we do that. Say ah. Perfect. Good job, buddy. Now the other place that I would say patients tend to miss is right behind those lower front teeth. So when you're doing that, perfect then, thanks. So right behind those lower front teeth, you're not going side to side. You are going up and down. And the reason for that is those teeth are pretty narrow, and you also have that curve of the arch there. So if you're going side to side like this when you're brushing your child's teeth, you're going to be missing a lot, especially if they have some crowded teeth like Vinny does here. You want to make sure that you go up and down. Okay, make sure that we are actually getting all the way down to the gum line, cleaning all those little nooks and crannies, and getting around that arch to hit all surfaces. Last place I want to draw your attention to is the upper molars. This is another place that's really tricky for everyone to get because our cheek muscles actually lay over top of those back molars. And this is the same for kids and adults. That is a space that is commonly missed for everyone. So what I usually do is I have them open, I put my toothbrush here, and then I have them close slightly, close a little bit. And then that way that relaxes this cheek muscle, and I'm able to actually retract further out and get back all the way around that back molar. So again, takes lots of practice, but this position has definitely helped me be more thorough in home care with my kids, and I hope it really helps you too. So happy Tuesday. Hope to see you here in the office soon. Have a great day.